Hello everyone. So today we are back again for one more lecture on CNS system, as I have been getting many requests from students who wanted to learn more about CNS system examination. So today we will see something about coordination. If you remember, in our last video on posterior column tract system, we checked for coordination, because coordination primarily is under the control of cerebellum, under the influence of extravertebral system, plus it is also controlled by posterior column to a certain extent. So whenever we are checking for coordination, we check the patient with eyes open, we check the patient with eyes closed. So that eyes closed component is to check for the posterior column. But whenever we are checking for coordination, few things are to be kept in mind, that coordination can be checked only if the power of the patient is more than grade 3, because then he will have to act against gravity. The patient should be explained the procedure fully, so that there is a smooth examination of the patient. So for coordination system, we first explain the procedure to the patient, we check the coordination in the upper limb, we check the coordination in the lower limb. So today we are going to see this only. So again we have our friend, our junior doctor, Dr. Ayush, who will be volunteering this session for you all, and we should thank him from the bottom of our heart for enlightening us by means of his self participation. So for upper limb, there are few methods to check for coordination. Like first, the finger to nose test, where you ask the patient to outstretch, or you take the right hand, outstretch the hand and ask the patient to touch his own nose in a lateral way like this. So आपको ऐसे check करना है, and ask the patient to repeat it once or twice or thrice. In cases of incoordination or cerebellar lesion, the patient won't be able to touch his nose properly. But I would like to make a point that the patient should touch the nose like this. Touching the nose like this is an incorrect method. So you ask the patient to outstretch the hand and touch the nose like this. Second method is finger nose test, where you keep your finger, as we saw in the posterior column lecture. Patient will first touch my finger and then his nose, and simultaneously keep on repeating this fast, and you can change the position of your nose, of your finger, so that you check for the coordination like this. So you keep changing your finger, and the patient touches your finger and then touches his own nose. This is second method. Third method for upper limb is the circle tap, where I have the book, where we draw a small circle like this, which is approximately 1 centimeter in diameter, and we ask the patient to constantly tap inside the circle. Like my coordination is normal, hence I am tapping inside the circle. Had I have some sort of incoordination or some cerebellar lesion, the patient will tap some points inside the circle, some points outside the circle, some point inside the circle, some points outside the circle. So this is incoordination. The patient won't be able to tap inside that 1 centimeter circle. So this is the circle tapping test for coordination. The fourth test for upper limb is dysdiadochokinesia. What is dysdiadochokinesia? It is the inability of the patient to normally or symmetrically perform small repetitive movements. Like in this case, we ask the patient to pronate and supinate the forearm, and side by side we ask the patient to clap on his other hand like this. So this is dysdiadochokinesia. For a normal patient, आपको ऐसे करना है, आयुष. So he is able to do it properly. Now with the other hand, he is able to do it symmetrically because he is normal. In case of cerebellar lesion, he will not be able to perform this rhythmically and symmetrically. So this is dysdiadochokinesia. This was about the upper limb. Now for the lower limb, I would like to ask Ayush to lie down. We ask the patient to raise his one heel of the leg, touch the base of his patella, and then slide the foot towards the ankle. This is the heel knee test for coordination of the lower limb. So आप करके दिखाइए. So he will do it on his own because he is a normal person. Through the other leg also he will be able to do. But whenever the patient have incoordination, the patient will not be able to do this knee heel test. Similarly, just the circle tap test. Please आ जाओ यहाँ पे. We will ask the patient to tap his heel on the floor one by one. So he is able to tap it properly one by one because he is a normal person. In incoordination, the patient will not be able to tap his heel on the floor properly. So this is again one of the tests for coordination, checking the coordination. Lastly, I would like to make a note that whatever test we have done on this bed with the patient can be normal in a number of patients, because even with incoordination. Why? Because in certain lesions like a posterior midline posterior fossa lesion, or lesion of the cerebellar vermis, or lesion of the cerebellar tonsil which is getting stuck at the foramen magnum, all these tests can be normal. The only hint in these three conditions would be a gross ataxia. You know the cerebellar ataxia, it's a drunken gait. The patient will not be able to maintain the posture anyways, random drunken gait. So gross ataxia can be the only sign that will show, or that will hint you that there is something wrong with the cerebellum. What did I say? Midline posterior fossa lesions, cerebellar vermis lesions, and cerebellar tonsil which is getting stuck at the foramen magnum because of any cause. These are the conditions where you may find these test of coordination normal, but the only hint of abnormality would be a gross ataxia of the patient. So this was the way how you check for coordination as a part of CNS examination in any patient. I hope I will be able to bring and come up similar videos in the future soon. I thank every one of you for your patient watching again.